Yeah, please, I want to ask you a question. Can I go ahead?
Go ahead.
Two people want to go on a date, a guy and a girl, a date that can lead to marriage. What's the most important question they ought to ask themselves?
Oga, sorry, me I know even dey for relationship. Why
No.
I want take answer relationship matter?
No, I'll not say you did relationship, but if two people when one go.
Okay, person wey no get car, how you want take know the price of fuel for a filling station? I no know.
Okay, no verse, sir.
No verse.
Yeah, thank you.
Oh my God!
Macaulay, if a guy and a girl want to go on a date, first date, what should be the most important question they will ask each other? To you, what do you feel supposed to be the most important question a guy and a girl ought to ask each other on a first date?
They can ask themselves. I don't know how someone to put it in.
Okay. And just put it.
What? Bro, what are you talking about, man?
And you know that some have different options, different way.
Yes. Okay, on your first date with your girl, what's the most important question? You can ask other questions, but what do you think is the most important question you have to ask the girl?
I can ask him if she is single.
Okay.
Yes.
That's the most important.
Yes.
Okay, what if she is single? Which other question do you think is the most important that you have to ask? This is a girl that you want to marry, not just because you can go out with many girls, you get, but this is a girl you want to marry.
Asking, I don't like double dating. I don't like other boys to come and be beating you at my back.
Okay. You want to marry this girl, like maybe if you guys start dating, next 1 year months you are married. So what was the most important question you have to ask the girl? If she does not want to double date, what's the most important question you want to ask the girl?
That she doesn't want to marry.
She don't want to double date. But what's the most important question you have to ask this girl?
You know that right now, but I don't know what.
What about genotype?
I don't know what.
What about genotype?
I don't understand that.
You don't know what's genotype? Eh? Okay. You don't hear of sickler?
Sickler? Like?
Sickle cell anemia. When they say Pekin and sickler. Okay.
What? Bro, what are you talking about, man?
When a guy and a girl wants to go on a date, a date that can lead to marriage, what's the first question? What's the most important question they have to ask each other?
What do you
No, I said the most important. They have to ask each other. That is very important.
Very important.
You can speak.
First, what do you do?
You know what the person does. It's something that you like. What's the other important question you have to ask?
Before joining, me set. She's a foreign zafanya cho and bed. She's a foreign zafanya.
That thing can end the relationship or it can make the relationship. It's very important.
Very important.
Have you heard of genotype?
Yes.
Like a boy and a girl, they want to go on a date, and that might lead to marriage. And they want to start something that might lead to marriage. And they what's the most important question they're supposed to ask each other?
To me, the questions that they ask each other, maybe the girl will ask the guy, is it marriage or you just want us to be together as friends?
Okay, it's marriage.
Okay, the girl will ask the guy, due to my own, are you sure you are ready for this marriage?
He's ready. What's the most important question?
The most important question to me now is, sure this marriage that you want us to be together should not be a marriage of pain and sorrow. You are ready to take good care of me.
Get ready. I want you to jump. Get ready.
Good evening, everyone. Let me stand up to address this issue to know how important it is. Yeah.
When we think of first dates, we often imagine light conversations, favorite meals, hobbies, or even jokes to break the ice. But beneath the surface of romance lies a conversation that could save future generations. What is your genotype? It may seem awkward or too serious to ask early, but in a country like Nigeria, where sickle cell disease is highly prevalent, that one question could prevent a lifetime of pain, suffering, and regret. What is genotype, and why does it matter? Genotype refers to the genetic makeup that determines certain traits, including whether someone carries the sickle cell gene. The most common genotypes relevant to sickle cell are A. Normal, AS carrier of the sickle cell trait, SS has sickle cell disease, SC, AC other variants that may also pose risk when inherited. When two carriers A, S and AS get married, every pregnancy carries a 25 chance of producing a child with sickle cell disease. S. Closing parenthesis. What is sickle cell disease? Sickle cell disease is a serious, hereditary blood disorder where red blood cells become misshapen and sticky, forming a sickle-like shape. These abnormal cells get stuck in blood vessels, block blood flow to organs and tissues, cause intense pain called pain crises, lead to anemia, stroke, infections, delayed growth, shorten life expectancy. Hematopoietic stem cell transplant can cure sickle cell disease in some patients. It works by replacing the patient's bone marrow, which produces sickle red blood cells, with healthy marrow from a genetically compatible donor, usually a matched sibling. Best results occur in children with a matched donor. It carries serious risks, including infection, graft versus host disease GVHD, and transplant rejection. It's not commonly used unless the disease is severe. Due to these risks and donor limitations, newer methods like gene therapy are also being developed and showing promise. Management involves lifelong treatment, constant hospital visits, and emotional trauma, both for the patient and the family. A hidden crisis in Nigerian hospitals. It is alarming that in most pediatric wards across Nigeria, almost half of admitted children are living with sickle cell complications. Doctors and nurses are overwhelmed. Resources are stretched. Children miss school. Parents miss work. Many families are silently suffering, often unaware that this could have been prevented through genotype screening before marriage. Love is not enough. Choosing a life partner goes beyond emotions. If both partners are AS or carry other incompatible genotypes, they risk having children with SS unless they use medical alternatives, which are not cheap. Can it be prevented if AS marries AS? Yes, but it comes at a cost. Couples who insist on marrying despite genotype incompatibility may opt for pre-implantation genetic diagnosis PGD, in vitro fertilization IVF. These allow doctors to select embryos without the sickle cell gene before implantation. However, the cost of PGD plus IVF in Nigeria ranges from 1.5 million to 3 million or more, far beyond the reach of many families. Why the conversation must start early. The tragedy is that many find out too late, after falling in love, after marriage, or even after the birth of a sickle cell child. But all this can be avoided by asking a simple question early. What is your genotype? It's not harsh. It's wise. Just like asking someone about their values or goals. This is a health and future-focused decision. Let's change the culture. Normalize talking about genotype on the first or second date. Teach genotype awareness in schools and youth groups. Churches, mosques, and communities must educate couples before marriage. Free genotype screening should be made available at the primary care level. Conclusion: this pandemic is preventable. We're seeing a silent pandemic of sickle cell disease in Nigeria, with thousands of children affected, families burdened, and health systems overwhelmed. This does not have to continue. With increased awareness, timely conversations, and wise decisions, we can break the cycle.